Hello all, welcome. In this video we are going to see about Csirnet previous year question concept series. Today's topic is about cardiac system. In this video we will be covering all the questions from cardiac system from the time period 2015 to 2007. And you are watching this on Life Science Library. If you do like our initiative, please give a thumbs up, like, share, subscribe to our channel. And you are watching this on Life Science Library. Let's get started. First question from June 2015. In ECG, we have various waves like P, Q, R, S, T. So here we have a question that what this S waves exemplifies. P waves is associated with atrium depolarization, QRS ventricular depolarization, T ventricular repolarization. So S wave is associated with late depolarization of ventricular walls moving back toward atrioventricular junction. B is the right answer for this question. Next question. This question is regarding Starling-Frank law. In this question, we will learn a new concept called Starling-Frank law. So, what this law actually states? Stroke volume of left ventricle will increase. Stroke volume of left ventricle will increase when due to myocyte stretch and systolic contraction. So what is said that end diastolic volume, that is ventricular end diastolic volume and stroke volume relationship, we have a graph that signifies that this part of the graph shows maximum capacity to provide stroke volume, maximum. This is normal range of stroke volume with end diastolic volume relationship. In this question, we are asked to find what will happen if it is infused with norepinephrine. So, norepinephrine is associated with is actually hormone from adrenal medulla, can also act as a neurotransmitter. It is from parasympathetic system that increases heart rate. So this will increase. Question here does not exemplifies whether this dotted lines shows norepinephrine infusion or dotted line shows normal things. So we are not able to conclude an answer for this graph. But this is the concept behind this question of Starling law and Frank law. Okay. Most of the sympathetic ganglions, in contrast to noradrenergic neurons, because they release noradrenaline, commonly known as norepinephrine. Okay. So let's see about two systems, that is parasympathetic system and sympathetic system. In sympathetic system, glucose level will increase, dilate bronchioles, heart rate increase, decrease urine output, dilator of muscle, stimulates epinephrine and norepinephrine. Okay, so it comes under this category. It increases heart rate, so ventricular end diastolic volume and stroke volume, all those will comparatively increase. So what will happen here? Opposite will happen. No effect on glucose, on constrict bronchioles. Okay. Heart rate, with regard to heart rate will decrease. Kidney has no effect. Blood vessels, no effect. Constricts pupil. Okay. This is the effect on adrenal medulla with respect to sympathetic nervous system. So sympathetic nervous system comes under epinephrine and norepinephrine, and it causes increase in heart rate. So increase in heart rate with respect to the Starling and Frank law, it increases stroke volume, end diastolic volume, all those will happen. Next question from December 2014. So what is about heart rate? This is a logical question. Anybody from any background can answer this question. So with respect to heart rate, how it respond? Heart rate is accelerated during inspiration and decelerated during expiration. So B is the right answer. Next question from December 2013. Electroencephalogram. We have seen this question already when we saw nervous system previous year question concept series. Go back and remember. Let's recollect what will happen when an ECG was recorded and its power spectrum analysis was done in rat with implanted electrode. For longer time, power of electron encephalogram waves decreased 2 months after the electrode implantation. This observation may be due to following. Glial cell accumulate surrounding the exposed tips to electrode. Okay. Degeneration of neurons occurs surrounding the electrode tips due to metal ion deposition. B is the correct answer. Okay. December 2013. Only bone marrow cell that never appears in the peripheral blood. So, only bone marrow cell that never appears in the peripheral blood, that is megaloblast. D is the correct answer. So what is peripheral blood? Peripheral blood is nothing blood that flows through artery, vein, organs, and the blood that is taken from our body normally for any diagnosis and analysis. This is called peripheral blood. D is the correct answer. June 2013. Size of red blood cell in venous blood is greater than that of arterial blood. This increase in size of red blood cell in the venous blood is due to there is difference between arterial blood and venous blood due to chloride shift. Chloride shift is the major reason between increase or decrease in the size. It is due to increased osmotic pressure in RBC during chloride shift. What will happen during chloride shift? So consider this as a blood cell. Consider this as a blood cell, this as a blood, as a cell. Consider this as an RBC. So carbon dioxide enter here. It combines with what it do? It combines with water to form carbonic acid. The help of an enzyme called carbonic anhydrase to form H2CO3. It again dissociates to form HCO3 minus. This HCO3 minus will be transported out of the blood, that is RBC, and chloride ion goes inside for compensation. This is the major reason of change in the size of RBC between arterial blood and venous blood. Hope so clear about chloride shift. Coming back. Size of red blood cell in the venous blood is greater than that of arterial blood. This increase in size of red blood cell in the venous blood is due to increased osmotic pressure. So our new learning is venous blood. In venous blood, size of RBC increase. It is due to chloride shift. Okay. Then, chaliye. ISC Bangalore 2013. Aspirin. So, aspirin is prevent blood clot. B is the correct answer. Bangalore 2013. When working maximally, mammalian muscles use approximately 10 to the power minus 3 moles of ATP per gram per minute. However, there is only about 5 into 10 to the power minus 6 moles of ATP present per gram of resting muscle. Through one of which of the following means does muscular system meet the demand for ATP for sudden intense muscular activity? First option, synthesis of ATP from ADP and phosphate. No. Glycolysis, immediate for muscle. It is mentioned clearly. Muscle needy. Utilization from other tissues. So from other tissues ATP is present. It should be transported, for that energy should be utilized. No. Easy way is breakdown of phosphocreatinine to creatinine, because phosphocreatinine is stored in skeletal muscle. This is the easy way. So, C is the correct answer. December 2012. We have seen in the previous videos of nervous system, previous year question concept series about enkephalin and beta endorphin. So we are not going to justify the same. It's already justified. It's not the right answer. They are brainstem inhibitors and spinal cord inhibitors, and enkephalinus help in pain perception. Okay, this can't be the right answer. So D can't be the right answers. Then blood volume decreased when a mammal bleed rapidly. However, cardiovascular changes resulting from hemorrhage could be minimized by following compensatory mechanism. Increased cerebral flow, how it can be compensated? Is correct, not correct. Bilkul galat. So, the right answer for what? Wait. So, the right answer for this question is B. Hope justified. Answer justified. Same question. Okay. Next question from cardiac cycle. We have made a video in our channel regarding cardiac cycle, and all these formulas are explained in that video. You can very well go back and watch this lecture. So for a normal heart, time taken for atrial systole and diastole are AS, that is atrial systole, atrial diastole in seconds respectively, while some of the ventricular systole and ventricular diastole equations are correct. So what is the correct statement? This is equal to, left is equal to right. A is the correct answer. Normal ECG, which is absent in frog. P, R, T will be present. Q absent. So B is the right answer. Next question from June 2011. Organisms having heart for circulation excretes through green gland, and it has several ganglia, tactile organism, and it is most likely respire by. How they respire? These organisms that have green gland excretion respire by gills, and their circulatory system will be open type, and the big example for this criteria is prawn and some sea animals. They have such type of setup in their body. So I have made it clear that these characteristics are seen in marine animals. Exchange through thinner areas of cuticle by gills. So for this 2 and 3 question, C is the correct answer. And the question from atrial systole and diastole, we made it clear that atrial systole plus atrial diastole is equal to ventricular systole plus ventricular diastole. So here they are asking about ventricular diastole time. Now arriving at answer, atrial systole plus atrial diastole minus ventricular systole. For this question, A is the correct answer. From December 2010. So basophils we are going to find incorrect statement. Basophils are present in least amount, correct. Neutrophils major phagocytic cell, correct. Platelets play an important role in blood clotting, correct. A is the incorrect. Mature RBC is of larger size as compared to its precursor cell. This is incorrect. This is new learning. Mature RBC size is little less when compared to precursor. Okay, chal. Serum. June 2009. Serum. Serum contains non-fibrinogen proteins. So what is serum? Serum does not have no clotting factors. So fibrinogen is a clotting factors. It does not have blood components like RBC. So B and C can't be correct answer. We can eliminate. It contains only minerals and glucose. It is just a saline. No, it's not a saline. D is incorrect. So A is the right answer. Next question from June 2008. Major difference between artery and vein based on the thickness. Vein is thinner. So only then we can extract blood from vein. When we go to hospital, a nurse will come and extract blood from venal blood because it is thinner. Atrial blood is thick. Atrial wall is thicker. Venous wall is thinner, so they can easily pierce in and get the blood. Okay. So A is the correct answer. Next question from December 2007. Which statement is correct regarding arteries and veins? Arteries have single valve, while veins have two valves. Read this statement. Blood vessel A has thicker wall, narrow lumen and no valves. So it is saying that arteries have no valves. New learning. Artery have no valve. Okay. But D is thin, wide and have valves. Here it is said that arteries don't have valves. When arteries have single valve, no. A is incorrect. There is no difference. No, there is a difference. Arteries carry deoxygenated blood. It has thicker wall. No, it does not carry, but one exception is present. We know that. It's pulmonary artery, pulmonary vein differentiation. Veins carry deoxygenated blood and has thinner wall. This is correct. New learning of the day is artery. I'm so sorry. Artery has no valve. This is interesting. Okay, interesting to know. Okay, we reached end of this session. So far, I made everything clear of the previous year question. Except one, this question, where this Stokes line differentiation is not present in this question, in the question series that I have. So I am not able to, but we saw the exact concept of Starling-Frank theory. Yes, this question needs explanation about renin, angiotensin, aldosterone system. So once when hemorrhage happens, when there is loss of blood, body strives to maintain blood pressure and volume. It secretes ADH to absorb water from interstitial fluid to maintain osmolarity, to prevent hypovolemia, ADH in general help in ADH in general help in water retention. It also helps the blood vessels to contract and maintain blood pressure. Blood pressure will fall down when there is an hemorrhage and a heavy loss of blood. So ADH is a major role in it. This is the concept. ADH has a role during, it is vasopressin, has a role during hemorrhage. ADH work along with renin, angiotensin, aldosterone system. We will see this system clearly when we see question concept series of excretory system. Okay, as of now you can understand this. We reached the end of this video. Hope you like this video. And thank you very much for watching this video. Thank you learners. Thank you all. If you like this video, please do refer this video with your friends and fellow aspirants. Thank you.